Good afternoon. My name's Janie Gordon, and I'm with the Mid-Atlantic Public Health Training Center. And on behalf of our training center and the Maryland Department of Health and Mental Hygiene, I'd like to welcome everyone to our November 20th Grand Rounds on industrial food animal production operations, who is protecting affected communities. I have a few announcements before we get started. For people who are watching online, please check out our archived Grand Rounds and other online trainings. Our next Grand Rounds will be January 15th, 2014, and will address aging in place with community-based services. We will not be having a Grand Rounds in December, but we will be starting up again January 15th. For those watching online, you can email a question for today's presenters by simply clicking on the link, or you can send your email to maphtc@jhsph.edu. With that, we're ready for our presentation on industrial food animal production operations, who is protecting affected communities. I'd like to introduce today's speakers and say at the outset that we were able to get two excellent speakers with vast experience on this topic. Jillian Fry received her PhD in Health Policy and Management from the Johns Hopkins Bloomberg School of Public Health, completing her dissertation on the effects of poultry production on Maryland's Eastern Shore and the regulatory efforts to clean up the Chesapeake Bay. She now directs the Public Health and Sustainable Aquaculture project at the Johns Hopkins Center for a Livable Future, where she works to engage public health communities in increasing awareness and understanding of the public health implications of industrial aquaculture practices and efforts to move toward more sustainable and responsible methods of production. Our second speaker comes to us from Washington, D.C. Patty Lovera is the Assistant Director of Food and Water Watch, a nonprofit advocacy organization that works to ensure that the food, water, and fish we consume is safe, accessible, and sustainably produced. Patty has a bachelor's degree in environmental science from Lehigh University and a master's degree in environmental policy from the University of Michigan. Before joining Food and Water Watch, Patty was the deputy director of the Energy and Environment Program at Public Citizen and a researcher at the Center for Health, Environment, and Justice. So we're ready now for Jillian.
Thank you, Janie. I'm very excited to be able to share some results from a study that we did relevant to this topic about various agencies and how they protect communities from industrial food animal production. I want to tell you a story about how this study came about. At the Center for a Livable Future, we work on studying the links between food production, diet, public health, and the environment. And we also work to translate what we do into policy change. And I was attending a public meeting for a local community with a colleague, Ronnie Neff, and they were discussing an issue having to do with industrial food animal production. And someone stood up, a proponent of this type of food production, and said that if there were any health issues associated with industrial food animal production, that the health department would certainly be involved and would certainly let them know. And they hadn't heard anything from the local health department or the state health department, so there was no reason to be concerned. So right away that piqued Ronnie's and my interest, and we thought, you know, if it's not clear about how involved health departments are, then maybe we can do a study on it to try to figure out what the level of involvement is and if there's any barriers to involvement. It was especially interesting to us because being involved with that specific case, we knew that the health department was not involved. So here's our roadmap. I'll tell you about industrial food animal production. We refer to it as IFAP, so when you hear me refer to it that way, you'll know what I'm talking about. I'll tell you the research questions and the methods that drove the study and our results. We have results from health departments, community members, permitting agencies, and agriculture agencies, and then concluding thoughts. So we'll start with IFAP. How does it impact public health? How is it regulated? I'll give you a brief overview and community impacts. We also need to keep in mind there's negative impacts from IFAP, including inefficient use of resources, ecological effects, and animal welfare concerns, but I don't have time to go over all of those issues. So the first trend that I want to tell you that describes what IFAP is, over the past several decades, our food animal production has used fewer larger operations. So this graph shows you a black line that's a very severe downward slope, and that shows us the change in number of hog operations from the late 1950s to the late 2000s, and the trend goes from about over 1.8 million hog farms to less than 100,000. And the red line that is sharply increasing shows the average size of hog operation, and from the 50s it is under 100, and then in the late 2000s, it's about 900. And some are much, much larger than that. That's just the average size. So we have fewer operations, but much larger. There's similar trends with other types of animal operations as the hogs. We also see significant geographic consolidation. So the top map on this slide shows chicken processing plants. Each dot shows where a processing plant was processing 50,000 or more chickens each year, and you can see that it's pretty evenly distributed throughout the country. And in 2007, the bottom map shows us each dot, now they've increased what the dot represents to production of 1 million or more chickens. And we see that it is very highly concentrated in the southeastern part of the United States, and we actually often refer to that area as the broiler belt. There are similar trends with other types of animal operations in terms of geographic consolidation, but their distribution is different than what chickens look like. Some states are burdened with different types of animal production, but they don't all look just like the where poultry is produced. One concern, one of the most significant concerns with this type of animal production is the amount of waste that we're dealing with. So Americans, humans, produce about 8 million tons of waste, human manure, that type of waste per year. And the over 9 billion animals produced for food, land animals produced for food in the US each year, produce about 335 million tons. So of course, human waste, we have a lot of infrastructure to treat that waste, and we don't have that type of infrastructure to treat animal waste. It's generally spread on fields, often over-applied as a form of disposal, which has very significant public health and ecological impacts. And of course, we know from our previous slide that operations are being geographically consolidated, so we have not only so much waste to deal with, but it's also concentrated. So here's a picture of industrial hog barns. Each of these sites would house about 9,000 hogs, and you can see that there are 2 in the primary area in the picture, and then 1 also up to the left. And the dark rectangles are manure lagoons, so that's where they store the waste from these hogs. And of course, people live in these areas. This is what the inside of a hog barn would look like. This is a massive poultry operation on the eastern shore of Maryland. There could be up to 600,000 chickens in this operation at peak capacity. And there are likely many other operations nearby in this vicinity. They're very, very highly clustered, and you can see that it's very close to a waterway, and that waste would be spread nearby on fields. This is the inside of a typical industrial scale broiler operation. And broiler means the chickens are being produced for meat. And this is what an industrial scale cattle feedlot looks like for beef production. So the main concerns have to do with exposure to animal waste, pathogens. Many will be drug resistant because 80% of the antibiotics used in the US are given to animals produced for food. People can also be exposed to drug residues, gases, particulate matter, and this is through air and water. So this is just one example of a route of exposure. We have a lot of epidemiologic evidence of the negative health impacts. It's really too many to get really into at a fine detail. But this is just one example. So you have all that waste in the left, that's from a hog barn. You also, if you look closely, there are big fans on the hog barns as well. So they are ventilating those barns forcefully so that the hogs can stay alive. So those gases are being pushed out into the community. And then the waste is being spread. It's also getting into the air. A lot of times neighbors will have a fine layer of manure on their cars after it's been spread on a nearby field, depending on the wind direction. If it's overspread and it gets into the ground and surface water, that can impact people's source of water. And of course, these types of operations are more likely to be found in rural areas, and people who live in rural areas are more likely to rely on private wells that are not monitored by government agencies. So there's many different illnesses that can be caused by the different exposures. So how is IFAP regulated? So my colleagues and I use the term IFAP, industrial food animal production. You might have also heard animal feeding operation or confined animal feeding operation, AFO or CAFO, and those are regulatory terms. We use the term IFAP because AFOs and CAFOs are defined by size, and you can be right under that threshold and still be using the same method of food production and threatening the environment and public health, and that's why we use a more general term. But it's basically the same as AFOs and CAFOs if you've heard those terms. And CAFO comes from the Clean Water Act. So the Clean Water Act is the primary, really the only federal regulation that has to do with these types of operations. And it is meant to reduce the amount of pollution that is entering navigable waters in the U.S. And the EPA is in charge of enacting the Clean Water Act. But the EPA actually doesn't permit CAFOs directly. They have the states run those programs, and the EPA actually doesn't even know where all of the permitted CAFOs are. There was a FOIA request to ask the EPA, where are all these CAFOs located, and they actually don't know because they don't collect that information from the states. The problem is there's a lot of variability at the state level. Different agencies are involved with different things. There's different requirements. So it's a bit difficult to give a complete picture of the policy landscape because there's such variability at the state level. So usually the state permitting agency that has the ability to permit these operations, they take that authority from the EPA, gives them that authority if they meet certain requirements. It's usually the Department of the Environment or Natural Resources. So you'll hear me refer to permitting agencies, and I'm referring to whatever agency in that state is in charge of the permits for these operations in the state, usually Department of Environment or Natural Resources. Other potentially involved agencies would be the health departments because of the health impacts, and also agriculture departments at the state level. So let's talk about the research questions and methods. So the first and most primary question we wanted to answer was, are state and local government agencies contacted about this issue? And second, how do they respond? And if they're not fully responsive, what barriers are standing in the way of a different type of response? And also, what is the experience of community members who may have contacted government agencies? So we wanted to get a full picture. We didn't want to just talk to government agencies. We wanted to ask the people who are actually contacting them and see what their experience was. So we chose 8 states. We used a qualitative research approach because there hasn't been any research on this topic. So if we tried to do a survey, we wouldn't know what questions to ask, and we would probably be missing a lot of critical information. So the qualitative approach, and we did telephone interviews, it allowed us to ask people open-ended questions and hear from them in their words what their experience has been, and also follow up with variable questions in terms of, depending on what they answered. And also some information we then added a new question for future interviews. So it was a very iterative process, and we were able to get a lot of very, very valuable information that we wouldn't have known to ask about. So we chose 8 states based on hog data and census data. So we wanted to make sure that there were a lot of hogs being produced in these counties, and that it also wasn't so rural that there were no people living near the hogs. And I'm not going to identify the states and the counties in this talk. We also don't identify them in the publications from this study, just for confidentiality purposes. So ultimately, we talked to 21 health departments, 13 counties, and 8 at the state level. So we interviewed all of the state level health departments that we contacted. We also talked to one community member from each state. It's a bit of a small sample, but we wanted to try to get that perspective, and we got some very valuable information. We also interviewed 7 representatives from state permitting agencies and 5 representatives from state agriculture agencies. So first, the results from the health departments. Health departments reported generally that they heard complaints, they were contacted by people concerned about health issues a few times a year to a few times a month, but we did hear that some have not been contacted by concerned residents. And I'll come back to the significance of the frequency of concerns, because there's a big limitation on relying on that information to tell us how concerned people are about this issue. The most common issues were odor. Of course, that has to do with air quality and has very important health implications. It's not just a nuisance. Water quality, respiratory health, and general health concerns. Health departments report that they largely take a case-by-case approach to responding to these concerns, and they don't keep formal records. So that's a concern, because people can have notes in their different notebooks or nothing is written down. So if you call them and say, who's contacting you about this and what's being done, they really can't tell you because they're not keeping formal records in one place. And in almost all instances, people are referred to other agencies. So this is really key to keep in mind. And the most common referral was to permitting agencies because they have jurisdiction over these operations. A couple quotes from state and county health department staff. One person said, "The best we can do is bring it to the operator's attention and hope they take care of it voluntarily." Another person said, "We have no control over manure spreading or manure management. All we can do is consult with the farmer to try to work with them." So that's been their experience. The main barriers, the top barrier is a lack of jurisdiction. The health departments don't actually have any rules to enforce. So when they're called about a concern, like you saw in the previous slide, it's about voluntary action. They don't have any rules that they can enforce related to health issues. Also, it's a resources and infrastructure issue. Someone said we have a hard enough time handling our own mandated problems. Of course, health departments are very stretched very thin and always constantly trying to do more with less funding, so that's a big concern. And also limited flexibility with funds. A lot of health departments, the bulk of their funding comes in to achieve certain deliverables, and they're funding certain programs and certain efforts. So when there's something on the side that doesn't have specific funding for it, it's harder to get a significant effort to deal with that. We also heard about a lack of expertise. People who work at health departments reported not really knowing what the health impacts were from these types of operations, because they're not hiring agricultural experts. They're hiring people with expertise in their main programs. We also heard a lot about political factors, which was very interesting. People report, especially in rural areas, when you consider the people calling in with a concern, the people receiving the call, the people that they work for, and the farmer, a lot of that, especially in a rural area, a lot of people know each other. There's different family networks. So that comes into play, especially in rural areas. There's also the economic importance, or the perceived economic importance, in rural areas. Some would argue that it actually depresses economic development in the area because people don't want to live near these operations, but it's also sometimes viewed as having very large economic importance, and the industry puts forth significant effort to prevent further involvement of other agencies. They don't like extra regulation. Not many people in industry do, so they're concerned about that. And they use their perceived economic importance to put pressure on people not to look into it. That's what we heard from health department representatives. Also, all of these factors influence elected officials, and health department representatives were also talking about that. So when we talked to community members, they reported little health department involvement. So it was completely consistent with what we heard from health department representatives. A key finding was that community members do not continue to contact health departments after being referred to another agency. And what that tells us is you can survey health department representatives and say, how often are you being contacted about this? And that will not reflect the level of concern in the community, because when people call health departments and the health departments say, we have no jurisdiction over this, we need to refer you to the permitting agency, people stop calling the health department because they're trying to get this taken care of. They're not just trying to report something to someone who has told them that they can't do anything about that. So that's really important to keep in mind. Community members, they recognize that health departments have limited resources. The political and economic barriers were very consistent with what we heard from health department representatives. And they also reported that they do a range of activities to try to fill the gap that they perceive. So they are contacting policymakers at every level. We heard about people forming community organizations, sometimes hiring a lawyer, organizing public events, et cetera, et cetera. So some groups have been very, very active to try to kind of fill the gap where they're not getting a good response. So for permitting and agricultural agencies, all of them had been contacted about concerns. We did hear that permitting agencies are contacted more often, which makes sense since they have jurisdiction over these operations. The most common are very similar to what health departments heard: odor, respiratory health, groundwater concerns, and violations of regulations. So they were calling to say, I think this might be a violation. And they had a health concern related to that. Permitting agencies, they tend to gather more information, do inspections if they think that there will be a response, and they also refer to other agencies, which was surprising to us since they are the primary agency with jurisdiction over these issues. And they said that they generally do keep records on this. For agricultural agencies, sometimes they investigate, sometimes they refer. It varies widely because from state to state, the jurisdiction in the agricultural department really varies. So some are involved with the permits, and some really have no involvement with any regulation of IFAP facilities. The majority of all of the interviewees, in the permitting and the agricultural agencies stated that health departments should play a role due to their health expertise in this area. And here's some quotes from the permitting and agricultural agencies. There used to be more calls about odor, but there are no odor regulations, so there is nothing we can do about it. The public learned there's no point in calling about odor complaints. So again, that speaks again to people, to asking people the frequency at which they're contacted. It really doesn't reflect the level of concern. If the problem is not covered under the agency, it might be a phone call or email to let people know why we can't address their concerns. Water issues are our primary jurisdiction. There are no state or federal regulations over air emissions. In a couple states, there are air regulations, but most states there are not, and there is no federal level. So that bottom quote is from someone who is in a state where they do not have a regulation about air quality. And regarding the involvement of health departments, someone said, if anyone's going to address health issues, it would have to be the health departments. From our perspective, we don't really have expertise in that area. And that was a common theme from other interviewees. So the barriers for permitting and agricultural agencies, they report limited budgets. For permitting agencies, they report limited budgets, staff size, and political factors. So political factors, just like we heard from community members and health departments. One thing that we found very interesting is permitting agency representatives reported that they were wary of producer, and by producer I mean farmer, producer or environmental groups with lawyers due to a lack of clarity in regulations. So when EPA is involved in a lawsuit, or they issue clarifying notes and change the regulations a little bit, it really means that the permitting agencies are really not sure what is required. And we heard that some permitting agencies are reluctant to really go after industrial food animal operations because they're afraid of a lawsuit. So they're afraid to be sued, and that really affects how they regulate these operations. From agricultural agencies, they were less concerned and not really reporting barriers because they have less authority. So they didn't feel that barriers were preventing their response. They just simply don't really have authority over these issues. So in conclusion, for health departments, we found that they're not playing a major role responding to health concerns related to industrial food animal production in the states that we sampled. And the main barriers are political factors and a lack of jurisdiction, expertise, and resources. And it's very important to note that our aim is certainly not to point the finger at health departments. There are many factors influencing the regulation of IFAP, including many external factors, but there are some internal factors. But it's certainly not our aim at all to be pointing the finger at health departments. We know that they're stretched thin and they simply do not have jurisdiction over these issues. So if people try to put an effort into regulating these issues and being involved, then I can see how they would feel that it's taking them away from other efforts that they have full funding on and a much clearer picture of their place and their role in that issue. Permitting and agricultural agencies have taken limited actions to address public health concerns, but that's really only when it falls into existing regulations. So if it's not related to water pollution, there's not much that can be done unless that state has regulations having to do with air quality. The barriers, like I said, the narrow or inadequate regulations. The Clean Water Act has a lot of implications for public health, but it's not designed to protect public health. It's designed to reduce pollution going into U.S. waters, but it doesn't have a public health standard. So the narrow regulations really prevent a much more robust response that would protect public health. There's also a lack of public health expertise within these agencies. They're not hiring health experts, they're hiring more type of environmental sanitarians, environmental experts who can enforce the specific regulations that they have, but they're not hiring health experts because that's not their charge. They also report limited resources. So we know that IFAP has negative impacts on health. This is a bit of an emerging health issue, but there is lots of epidemiologic evidence showing that it's bad for public health and has very significant implications. And our results indicate significant gaps in a system that should be protecting public health. So the reason that we conducted this study is to begin to understand the involvement of various agencies, especially health departments, to understand what barriers they face, and also to increase awareness of current levels of involvement. So a few ideas about what could be done. Ideally, we would pass legislation at the local, state, and/or federal level that would regulate industrial food animal production in a manner that is protective of public health, of the health of the workers and for surrounding communities. It would address air and water quality issues and provide needed resources for multiple agencies to monitor these sites for violations. I recognize that that is not a very realistic goal, especially in the short term, but I at least have to put it out there because ideally that's what we would do to protect public health from this type of food production. But what else could be done? Until this happens, health departments and other agencies with significant IFAP production in their jurisdiction, they could call on experts and conduct trainings so that their staff, they can build up the expertise within their staff to deal with these issues. And also agency collaboration is very important. So if health departments were able to, or if they put forth a significant effort to work with other agencies who have jurisdiction over these issues, then we can make sure that someone with a public health perspective was at the table when decisions were being made about how certain regulations are going to be enacted, how regulations will be altered at the state level, because states do have the ability to enact extra requirements above and beyond what the federal law requires. So if we have health experts at the table, that would be very important. And that doesn't, it requires people's time, but it doesn't require specific funding for that purpose. It's also possible that trainings could be made available without specific funding. There's probably groups that would be interested in making sure that people have that expertise. If you're interested in more information, this is the Johns Hopkins Center for a Livable Future website. The link is on the slide. And if you click on research and publications, about halfway down the page, you'll find the first publication that we published from this study in January of this year. oftentimes with a qualitative study of so much great information that you really can't fit it in one publication. So we have another publication that hopefully will be published in a few months. But the first one, the title is on the bottom of the slide, and that is published in an open access journal so that everyone can access that without going through a paywall. So I want to thank the people who participated in our interviews, who took the time to do that. Also the study team. I worked with Linnea Lestadius, Claire Greachis, Keeve Nachman, and Ronnie Neff. And Keeve and Ronnie both work at the Johns Hopkins Center for a Livable Future as well. And also, of course, the Center for a Livable Future, who was the funder for this study. So I'll take questions after Patty. I wasn't expecting it to go that way. All right, there we go.
Okay, I guess it's afternoon. Good afternoon, or maybe it's morning for some people on the webcast. My name's Patty Lovera. I work at the nonprofit organization called Food and Water Watch. So like we heard in the introduction, we do a lot of policy work and advocacy work to bring the public into these issues and get involved. And you won't hear me say IFAP as often because I'm usually talking to reporters or members of the public, and we have to go a little broader. So we end up using the term factory farm quite a bit. So you'll hear that slip in when I'm talking. And we also, when we are talking to agencies, which is usually the EPA, we slip into their terminology. So you're going to hear me say CAFO as well, which is the concentrated animal feeding operations, which is kind of the legal lingo for how you're talking about these facilities that are doing industrialized food animal production. So we've got a little bit of a taste from this from Jillian, but I'm just going to spend a couple minutes talking about this some of the why we have industrialized food animal production. Why are we raising animals this way? What has changed? Because we think there's kind of three broad strokes reasons why we've gotten to this point, and we think there's a failure to protect communities around these facilities and communities at large, the public at large. There's been a failure kind of on all three fronts. So I'm going to talk kind of broadly about those, and I think in each of those there's going to be something that rises up as we think a failure at the policy level to protect either the larger public or immediate communities from the impacts of this type of agriculture. So this is a map just showing kind of a different way to look at the same idea that Jillian talked about, that we are concentrating where and how we raise food animals. So this is a map that we generated, and you can see it online actually at factoryfarmmap.org. So we had to go through a torturous process I won't describe for you to find some raw data about where are these things. But when you do that and you put it in the visual of a map, you can see that we are really concentrating it. So that's all factory farmed type production combined, and the map is online, and you can go through and just look at broiler chickens or just look at dairy cows, and you'll see a lot of clustering for each type of animal. When you overlay all of it together, there's large parts of the country that are getting hit very, very hard with this type of production and the impacts. And it's a type of production that's increasing. So we do have some historic data on there to see that this is a trend where we're seeing more of this type of production, not less. And we think that we have that trend for a couple of reasons. So the system, the economic system in which we're raising these food animals has changed dramatically in the last couple of decades. That's not an accident. There's a lot of policy reasons for that. So I'll talk quickly about that. These animals have to eat something. And when you have that many animals in one place, they're not going outside the barn and grazing. They are confined. They're concentrated in an area so that they can be fed in what is supposedly the most efficient way, and that involves large quantity of grains like corn and soy. So the policies that set up how we raise corn and soy, whether they can be a raw material for this system, we think that's one of the things propping up this system. And then the third thing propping up this system is what we think is pretty much a completely inadequate system of dealing with the environmental impacts and the public health impacts of this. So I'm just going to spend a little bit on each of those three because we think they're all failures to protect the public, to protect communities that are around these things. So I'm going to spend just a minute talking about hogs. We already heard a little bit about hogs. We're obsessed with them. They're kind of the poster children of this model. And when you're talking about hogs, you end up talking about Iowa. So we did some work last year just specifically looking at some of the factors about hog production in Iowa to kind of delve into some of this consolidation piece what is the economic system that props this up, and how did we get here? So this is a really boring slide, but it matters because if you took economics, if you're taking any kind of economic theory, we talk a lot about we talk a lot about whether folks can make it in a different model of production, whether they can get into the agriculture, livestock sector in a different way. And with concentration, this is what concentration looks like when you have the market share of the top 4 firms over 40%, that's typically the line economists use, you don't have a competitive market. And we've been past that point for a long time, and it's pretty far past that point now. In 2007, some academics from Missouri tried to wrangle these numbers to figure out who controls the market for pork, and they said the top 4 firms control 65%. So that means you don't have as many options if you raise hogs for where you're going to sell them. And that takes us to a picture that looks like this. So we're concentrating where we raise hogs. They're a little bit hard to see, but if you go online, you can see a better picture. Those blue dots are the slaughterhouses where we pack those hogs, where they get slaughtered and they get turned into food product. And there is a radius of how far you're going to ship those animals. So if you have fewer but larger slaughterhouses, you're going to concentrate the animals that end up there. You're going to concentrate them around those points. So this is the national snapshot of where we're raising hogs in these types of farms. We didn't count small family farm operations that are doing something different. This is counting the ones that look like factory farms. So there's some economic drivers of this. For every one of those hogs, the farmers receive much less than they used to. Most of the dollar that's spent on pork doesn't make it back to them. And so rationally, they try to maximize the number of hogs they produce. You're not going to get paid very much for each one. You're going to produce more of them, right? You make it up with volume. And that is a result. That has resulted in fewer hog farms being around. We saw a similar, my numbers went away. That happened to me last week too. So this is a shorter time period than Jillian had, but from the 80s to 2008, in Iowa, we've seen a huge drop in the number of farms. And so this is nationally, I'm sorry. And then when you get to Iowa, I have some numbers there, good. In the 80s, we had almost 50,000 hog farms in Iowa. By 2007, you're under 9,000. And the blue line that's doing the opposite trend, that's how many hogs are at each farm. Right, so you have fewer hogs. We don't have less pork. We just have more animals at each place. And that's bringing with it all of these consequences. So this has a lot of impacts on rural communities. We heard about the health impacts and the role of local health departments, and their trouble grappling with this issue. It also really changes these communities, and that's an impact as well. And you see the snowballing, public health and social effects that come from that. So that's the thing that we studied last year and really tried to put numbers onto this. And we saw a lot of correlation between the counties that have the most hogs and all of the bad stuff in terms of economic indicators that you don't want to see, like decline in civic participation, less involvement in local government, increased, just reports of kind of the turmoil and the stress. These facilities do cause turmoil in local communities. It is not without controversy that they get built, that they expand, or that they exist, and it causes a lot of rifts in the community, sometimes even in families. And then on top of that, you add what we can start to measure of the public health impacts from odors, from water problems, and just people talk often about the loss of enjoyment, the loss of quality of life. They live in a rural area for a reason. If you can't go outside, you're not getting to use all of those reasons that you live where you live. So there's similar trends. I'm not going to make you go through every animal, but I'm just going to spend one more second and look at poultry, since I am here in Maryland, land of big chicken. We have a similar trend in who controls this marketplace. We have just a couple poultry companies are responsible for producing most of the chicken, and so that leads to a picture that looks like this. So we have the broiler belt that Jillian talked about. And that comes with, this concentration of waste, the concentration of those impacts. And that, again, is due to how many places you can sell a chicken. So just in this area, the Delmarva Peninsula, in the late 60s, there were 16 companies that you could sell chickens to that would process those chickens. Now there are 4. And there's one big one that dominates that market. That gives them disproportionate power in what gets done, how it gets done, what the production practices are. And it really, drives that get bigger, get out phenomenon that we're looking at. So again, this is a different system, and we don't think it's an economically healthy system, nor a system that's healthy for literal public health. So, contract poultry production is the model. These are not independent operators that make all of their decisions about how and what they're going to do. The terms are set by these big chicken companies. A lot of you are probably familiar with this. So I'm not going to go through all the gory details, but these are systems that take an enormous amount of power out of the hands of the actual farmers. They put it in the hands of the companies. They're making the decisions. And there's tremendous economic imbalance. And it really is based on contracts that wouldn't be allowed in any other sector of the economy, is what it boils down to. One thing that is notable to point out, though, is that these contracts do manage. So the contract growers don't own the chickens. They don't decide what they get fed. They don't make a lot of decisions. They are responsible for the liability of the manure that those chickens produce, right? This is no longer in amounts that are about fertilizer or being folded into a farm system. There is so much in one place that it is a waste. That's a liability, and that is left on the contract growers. That's not by accident. That's a design feature of this system and of the contracts that are used, and that leads to a lot of the dynamics and the local politics of whether or not health departments are going to get involved, whether or not you're going to see strong regulations to deal with the environmental impacts of that waste. So to kind of wrap up this first thing that's propping up this system, which is the marketplace. Where are people selling animals? What are the economic reasons we have these factory farms? There are things that should be done. Mostly at the federal level, there's some things that states could do to rein in, to rebalance these marketplaces. That we think would be a level of protecting communities, especially the producer community that is often caught in this system. So the Farm Bill would be the place to do that. I will not belabor you today with tales of a dysfunctional Farm Bill at this point, but in a functional Farm Bill process, which we hope to return to, where we are using that piece of federal legislation that designs the whole food system, when that's being done properly, when we're actually talking about what it's supposed to do and what it could do, these are the types of things it could include. So we could say that the meat packers shouldn't own the animals very far out into their life, which happens. There's something called captive supply, which I won't bore you with the details, but when the meat packers own the hogs or the cattle way before they need them, you're not going to have an open marketplace where people bid and you have an auction and you can get a good price as a farmer. They're using that to rig the prices. So those things could be illegal. They're currently allowed, and that's why we see folks getting out of livestock production. You could do the same thing for dairy pricing. You could deal with the mergers. We're seeing some mergers recently in the meatpacking industry. We expect to see more. There could be governmental intervention in that. We do have a system of antitrust laws that are supposed to deal with that. They have failed to do so recently. And then one very literal thing that could be done that would deal with the public health impacts, that would deal with the manure, is to flip that burden of liability. Who is responsible for the waste, especially in the chicken industry? And so there are some attempts to work politically, even here in Maryland, to do that. And the phrase you'll hear people talk about is integrator liability. So these firms call themselves integrators. They're a vertically integrated entity that starts with, they own the chicken and they own it the whole way through, but they don't own the waste. So we're saying they should own the waste too. It should be their responsibility. They shouldn't be able to push that onto individual contract growers. We would have to change the law to do that, but that could be changed. And that would be one way to protect that agricultural community and start to break up this model. So the next piece, the second of those three factors, is what are these animals eating, right? Why do we have, how can you raise that many animals in one place? You can raise them when you have a system that's destined just to funnel corn and soy into those systems so the animals can be fed there without having to do something else like put them outside and graze. So the Farm Bill is the reason we have that corn and soy available. So some folks at Tufts did an estimate a few years ago where they were trying to figure out, when you have a policy that drives overproduction of corn and soy, so that their price on the market, there's so much of them that the price per bushel is relatively low. Sometimes at different periods, not right now, but sometimes that price of production is even, that cost of producing the corn and soy is more than you actually get on the open market. And we have an elaborate system that's evolved, that's changed a lot since the mid-90s to make up the difference for farmers. So you'll hear about corn subsidies and soy subsidies. That is in response to overproduction. We have too much of it. The price goes down. It's not even going to cover your expense in raising it. And so we have a pretty elaborate Farm Bill process that's changed really pretty dramatically in the last 20 years that's propping that system up. The beneficiary of that system is not necessarily the corn and soy farmer. It's the Tysons and Purdue's and Smithfields of the world who are raising these animals, and when they go to the open market to buy corn and soy, they get a hell of a deal because the overproduction drives those prices down. So the folks at Tufts were looking at how much money does this farm policy save them, because they're not paying their full freight. They're not paying what it costs to produce the corn and soy. And we're talking about hundreds of millions or billions of dollars over the course of a whole industry. And so what's interesting in the last 4 or 5 years is we've seen those commodity markets change because of ethanol, because of drought, because of a lot of other factors. We've seen the livestock industry screaming about the cost of feeding these animals because they are dependent on those cheap corn and soy being available. And when they haven't been available in the last couple of years, there's been a lot of drama, especially in the chicken industry, because it's wrecking their model. So the Farm Bill is a place where we could start to deal with that. It is sadly more complicated than just ending the subsidies, which would be nice if that would work. We don't think it's that simple. So we need to restore some things we used to have to talk about why do we produce so much of this? Why do we have this overproduction that just drives this whole cycle? So until the mid-90s, we had more management of these markets. We had more policies that were determining how much got planted to try to stop, kind of break the cycle of overproduction. You can do that through a bunch of things called supply management. A key piece of that is something called the concept of grain reserves, which if it sounds old-fashioned, it is, but it works, which is the concept of when you have a bumper crop, you put some of it away. The reason you do that as a farmer is because then the price for you that you're in the marketplace, you're not going to have this glut, your prices won't be low, and the wisdom proven over centuries of human existence that someday there will be a bad year, and you would like to have those supplies, right? So it can take the top off of high prices for consumers in a bad year. You take some out of the reserves and put it on the marketplace. Can take the bottom off of a dip in price for farmers when there's a great year, which is ironically bad for them, right? Because their price goes down. We had these until the Reagan era, and then these were taken away, and we should put them back. So large farm organizations like the National Farmers Union are calling for the restoration of a grain reserve to try to deal with the craziness of what their profit, their usually not a profit, what their income sheet looks like, which is a heart attack. It's up, it's down, it's all over the place. They can't plan, there's a ton of volatility, and the meat industry is very good at riding that volatility. Establishing some supply management and evening out those markets would actually make it possible to raise animals in a different way. So that's kind of the Farm Bill piece. We could deal with the marketplaces we're selling the animals into and where they buy their feed. Those are the two of those three trends. And then that third trend is, are we regulating? How are we regulating the environmental impacts of these things? So Jillian did a great job talking about the local level, and it all kind of is intertwined. There's a big gap at the federal level of how we deal with these facilities, to the point, and this is going to sound made up, that the federal government does not know how many there are. So it's a little hard for them to adequately regulate the air and water impacts of an industry that they cannot find. They don't know where it is. They don't know how big it is. So I've just pulled out a couple things that we've been wrangling with recently that struck us in the face about how far we have to go in terms of actually regulating the environmental impacts of this. So another long story I won't bore you with, but we got the delightful task of reading through a bunch of documents that we got through the Freedom of Information Act from the Environmental Protection Agency about this issue of what they know about CAFOs, where are they, how many are there. And in the course of reading these documents, we saw that the EPA thinks there's about 18,500 of them. The USDA thinks there's 47,000. It's kind of a big gap for an industry that you're supposed to be regulating. So EPA is supposed to be regulating the air and water impacts of these things. And so we don't really have one agency that's in charge of knowing how many, what size, what type, how many animals are on a large facility versus a small facility. There's some definition problems, but there's a bigger problem that it's nobody's job to count them. So a lot of folks then say, well, how do you make that map, right? I just showed you a map a little while ago of where they are in the colors. We had to use summary data that the USDA collected for different purposes. They collected it in a census of agriculture. They went out of their way. They do it every 5 years. We're trying to do the next one someday soon when they release it. They go out of their way to make it hard to use, hard to combine, to make a national view, and they're not asking for this purpose. So it's very hard to use their definitions to say, the cattle in this county are being raised on a factory farm versus some other way. So we had to do an enormous amount of work with that data to make, and you'll notice that if you look at our map online, it's by the county. We're not showing you there's a feedlot here and there's a feedlot there because you can't figure that out. So we did some work this summer because at different points, we have had EPA attempts to regulate, especially on the water side. They've done a better job on the better is relative. They're still not getting it done, but they've done a better job on the Clean Water Act side of this equation. So we have all this manure in one place. It's land applied / disposed of, and we have inevitable water quality problems because of that. So in the letter of the law, the EPA can regulate these things under the Clean Water Act. They regulate other discharges into waters under the Clean Water Act, and they do that using a permitting system. This has never been adequately implemented for CAFOs. You would have a legal lecture if you get into why. There's been lawsuit after lawsuit after lawsuit over the last 20 years. There's a system in place now where states, under the permission of EPA, are supposed to create a permitting system. The latest iteration of that, I think, came out in 2008, and it relies on the CAFOs themselves to say that they have an intent to discharge. So it's not rocket science to see that if you don't want to have a permit, you say you don't have an intent to discharge. Therefore, we don't know where these things are. They're not filing permits. So that led to more legal action, which led to a settlement between some environmental groups and the EPA, where they said, okay, one thing we will do is we will collect information. And so that led to a process under Section 308 of the Clean Water Act. So you hear us talking about the 308 rule. They would have a process of collecting information about where these things are. That's it. It wasn't a regulation. It wasn't a new permitting system. It was just information collection about where are they. And so that process started in 2011. And then in 2012, EPA stopped that process. And they said, oh, you know what? We know enough. We don't need to collect this information, because they were under pressure from the meat industry not to collect this information. It got a little crazy. People were talking about privacy and lots of other things. And so EPA stopped that process and said, we have what we need. The states know what's going on. We can go to the states. So in the course of reading through all those FOIA documents, we try to figure out, do they have what they need? They didn't do the 308 rule. They didn't set up this database of where they are, and it wasn't good in terms of what they get from the states. So I'm not going to belabor all of these, but so the column on the right with the blue bars, this is of the 30-some states that put in records to the EPA or have some collection that the EPA said they could access. Most of them don't have any information or are missing large pieces of information about how many acres are being land applied with this manure. They don't know if they're discharging. 20 of the 30-some states were missing or have contact information, which means 18 don't. So we don't even know where these things are. We don't know who's running them. We don't know who owns them. And EPA didn't do this rule because they thought they had enough and they could go to the states, and they clearly don't. So EPA is guessing that maybe 41% of eligible CAFOs have federal water permits, but they're not sure because they don't know how many there are. 12 of the 38 states that granted permits were using permitting standards that were the most recent version. 18 of them were meeting a version that was 5 years old. There's a newer version of the standards they should be using to give permits. 6 of those states were even older than that. So we have a bunch of this stuff. That's the website on the screen there. We have a bunch of this stuff on our website where you can read some of these documents and read our analysis of the documents. But it boils down to EPA can't regulate effectively on the clean water discharges if they don't even know this. They don't even have a sense of the scope of this industry. So that's kind of the EPA version. And then just quickly, I probably don't have to tell this to an audience of public health people, but there's yet one more kind of aspect of the lack of protection for the bigger public health community, which is the overuse of important drugs like antibiotics, the unnecessary use of growth promotants of things like arsenic-based drugs and other growth supplements. So we did a little cartoon just to try to explain to the public that what happens, in a factory farm, adding nearly constant low-level doses of antibiotics. Maybe you don't live near this thing. Maybe you're not the immediate community, but this is a perfect breeding ground for creating the resistance that threatens all of us, no matter where you live, right? And there's different ways that it happens through the environment. This is the bacteria can teach each other to resist, right? You all know this as public health people. But that's yet another part of the government that has failed to rein this practice in. So the FDA is in charge of this. They do drugs for animals. They have limited some classes, but they have really just not stepped up on others. So, the action that's pending in the courts, or the courts told FDA you have to take action on penicillin and tetracycline, was started in the 70s, right? Hasn't been done. Took legal action to force that issue to even get them to start. And we're waiting and waiting and waiting for FDA to step up and really tackle the overall issue, which is, do you need a veterinarian to supervise the use, or should you be doing it in this routine way all the time through feed? Bigger picture things, as opposed to trying to go class by class by class, which is excruciatingly slow and has not worked to date. So one thing that you could do to fix that, where there's a lot of interest, is stopping the class by class, excruciating process, saying you're not going to use them in this way. You're not going to use non-therapeutic levels. There's a whole, y'all know here in this building, the whole battle over data and how much we don't know about the use of these drugs. There's a lot more that we should be doing. And then there's a lot of conversation to be had about how you raise animals, the husbandry, the conditions, and why you're using things like arsenic and antibiotics and these growth promotants. And so that's going to take a reorientation and training and lots of changes in that system. You don't do that overnight, which is why we had to start this conversation. A lot of folks, have been talking about FDA is not going to do this on their own, so there is legislation in Congress. There's a bill in the Senate and in the House that would take on the use, the routine subtherapeutic use of medically important antibiotics. So a lot of people are looking to that as a way to intervene with this kind of gridlocked cycle at FDA. And so that's, I think, becoming a public rallying cry for one public health impact of this system. It's one of many, but it's a critical one. And I think it's something that the public is starting to learn, no matter whether you're the community right outside the gate of a CAFO or 1,000 miles away. This is the one that seems to be cracking into the public consciousness that it is a public health threat that's caused by this system. So I'll just stop there as yet another option for the government to step up and protect people on the public health front. So, thanks. Do you have a PowerPoint? Okay.
Well, we've had two great presentations, and at this point we don't have any questions online. I'll go to questions in the audience in a moment, but I had a question, actually for both of you, which is in the work that you've done both in poultry and hogs, one thing that I didn't hear mention of was the workers in these facilities. And I know that that the industries are not largely organized by unions, but that there is a union presence in both poultry and hog or meat packing. And I wonder if there's been any interplay with the environmental concerns and the worker safety and health concerns, both in terms of working with unions and also looking at, at whether OSHA has regulations that may be enforced, and that in protecting the worker, the community is often protected also. So,
do you want me to start? So there's two different. It's a great question, and more time we would have gotten there, I'm sure. So it's a good question, and there's different communities of workers to think about. So there are workers on the CAFOs themselves. It's not a huge number of workers, but it's more. There are often hired labor who are working, at the dairy farm or the contract chicken operation or whatever. And so it's rare, if not to non-existent possibly, to see labor there, although I have heard of some very, very, very large factory farm dairies being organized by like United Farm Workers, but that's the exception. Where you see a lot more workers are in the slaughterhouses. So that's a labor-intensive industry. Some portions of the industry are unionized, some are not. The main union for those folks is the United Food and Commercial Workers. Right. So when it comes to OSHA, they don't have much presence on farms. And so it's unusual to see that play a role. They should have more presence in meat plants than they do. There's a current battle right now about a proposal to change how fast chicken plants can run their line. They already run quite quickly, the largest chicken plants. There's a proposal that USDA would let them run even faster, and we don't like that for food safety reasons. We don't think we can get everything done safely, taking apart that chicken, which matters when you're talking about pathogens. It matters for animal welfare, whether you've stunned the chickens properly and they're being handled humanely, and it really matters for the workers in those plants who are worried about accidental injuries. They're using knives, they're moving quickly, you worry about getting cut, but you also worry a lot about repetitive motion and musculoskeletal injuries, and there's been a lot of very scary research about the injuries these folks face from the sheer burden of making the same motion, 10,000 times a day over the course of a shift. OSHA is not present enough in those plants, and so USDA is thinking about allowing those lines to run faster in chicken plants. OSHA has not really been part of that. There's been a good coalition effort between groups like ours that are worried about the whole food system and food safety, and labor groups who are stepping up. And they're doing a good job, and they're raising it, and we need to get those other agencies more involved. So that's kind of pending right now to see if that happens. And there's probably antibiotics stuff that I don't know about workers that you can probably speak to.
I just wanted to add that there have been several very important studies where workers have been they do a study where they take samples on their skin or in their nose and have found antibiotic-resistant bacteria that are, and the specific resistance is associated with the drugs that the animals are being given. And of course, the workers don't stay on the operation all the time or in the slaughterhouse all the time. They return to their families and their communities. So that really illustrates the significant concern about the spreading antibiotic resistance with these types of operations, and the workers in particular being exposed to that.
And I wonder, just as a follow-up, Jillian, if you spoke with any of the workers in the facilities, and also what the interplay is with people who work at these facilities also living in the neighborhoods surrounding them, which is sort of an old model from industrial workplaces where people get a double whammy, so to speak. I don't know if you found that.
Well, we did not talk to workers for that study, but that would be a very interesting study. Sometimes it's difficult to conduct studies with workers just because of the fear of losing their job. A lot of times, these types of industries purposefully attract migrant workers so that they're dealing with people who don't have a lot of political power and are also being afraid of being deported. So it gives the industry more power over their workers than if they were employing U.S. citizens.
Okay. And any questions? And unfortunately, we're shorthanded today. There is a microphone right in front of me, and if anyone is brave enough to come and get it and turn the green light on. Any questions from the audience? No, we either have an unquestioning or a lazy audience. We have a couple from online. One of the questions is really looking at where the best chance for change is. Do you think the best chance is at the local level, at even a city or county regulatory level, or state level, or the federal level in terms of being able to, influence the process and get some good models, regulatorily speaking, developed?
I would say it varies by location. I think it's always good to have a multi-pronged approach with these types of complicated, large issues, but I would say that generally it would be easier to do it at the local or state level, but there have been instances in recent years where there has been an ordinance adopted in a specific county where the residents have decided we don't want any more of this in our county, and because of the political factors that I was describing, the economic and political power that the industry has, they will go to the state level and have the decision makers there squashed at the local level. So it would seem that a local level policy change would be not the easiest way to go, but the most realistic place for change. And then you have to worry about, even if you can get past the political power at the county or even more local level, it can be squashed from up above. So that's a really good question, and that's why I think the multi-pronged approach and trying to work where where concern is growing and awareness is growing, then work with that and try to move forward with whatever changes you can get.
I guess there's another question that, excuse me, that is related, which is, you talked about the political situation. Do people ever, in your interviews, did people go to like their local city council or county council, if it was a rural area, representatives about any of these complaints? And was there ever like sort of that kind of political interface?
Yes, the community groups that we've talked to, and I have familiarity with the topic not only through the interviews, but also just with studying this topic for several years. Community groups in some cases are very sophisticated and put significant amount of time and resources, because this is obviously impacting them right where they live. And like I was saying, they organize groups. They're attending all sorts of meetings at any level where they can hopefully create policy change and get some of these issues addressed. And like I said, it's really a mixed bag in terms of success, just because even if you try to get something through at the local or county level, oftentimes there's a lawsuit or there's a law passed at the state level that then makes that effort not useless, but reverses the result.
But actually, it usually happens as the result of communities having success at the local level. It's a sadly predictable trend. So people will pass even county health ordinances to say you can't build them this close to a school, or whatever criteria they put on. And if there's enough of that happens, it's pretty predictable that the next state legislative session, you'll see a bill that says counties don't have jurisdiction over this, the state does. In Ohio, I can't remember if this got finished a few years ago, they started the process of saying that the Ohio EPA, their environmental agency, wouldn't be in charge of the permitting. They were going to move it to the Department of Agriculture. So people have the most access to their government. They can see results locally, but they have to hook up statewide because it just shifts. And this is an industry with political power, and they use it wherever they have to. So we need to change things federally, but we're going to build up to that from the local level. That's very clear because people can see what they're doing there, but then you have to keep at it because it's never done.
Okay. Any questions now from the live audience? Okay. You can just pick up the microphone and push it till the green light is on.
Okay. Is this good?
Yeah, go ahead.
So how do consumers have a voice in all this? Maybe not necessarily, but with their vote, but with their fork. So let's say a consumer goes to the grocery store and says, well, I just want to buy something more sustainable, like USDA organic meats. Can that have an impact on the health of communities around these CAFOs?
It can if there's a lot of ifs. So we get this question all the time, right? And we, of course, want people to understand where their food is coming from. There's this huge educational gap we have to fill for people to understand that meat doesn't come from the back of the store, right, or off a truck. Like there's a whole production system, and most people don't know about it. So we need people to learn about it, decide they want to do it a different way. And that is very appealing, and it gives people great sense of involvement and some personal power in a system that I did a great job of showing you how depressing it is, right? So there's a huge role for that, but there actually still is a policy situation of whether people know what they're buying. So we spend a lot of time talking about, are you getting what you think you're getting? What is the best way to buy that you're actually voting for something different with your dollars, not just a different package? So as consumers are learning more and rejecting this model, we're having to play we're having to do some serious defense to make sure they're not then getting ripped off when they try to vote with their dollars. I spend far too much of my life at meetings where the organic standards are debated, and organic is a meaningful label. It's not as meaningful on this topic. There are still some very large-scale operations that are following organic standards because the organic standards don't cap size. There was a big fight. We're working on it. We're working on making the organic label better on animal welfare. It's not done yet. So then there's grass-fed. What does that mean? There's this, whatever. So the consumer advice we can give is to get as close as you can, to get out of the store and get to some kind of direct marketing arrangement where you can say, how was this food produced? What did you do? You can verify that yourself. That's not an option for a lot of people. So then we have to get into what are labels, are they meaningful? Do you know what they are? And that puts a lot of burden on the consumers to find the right ones. But it is a short-term thing that people can do. But even that doesn't fix it all because there's still a lot of shenanigans about natural. and cage-free, is it okay? There still could be 100,000 chickens in there. You know, it's not one silver bullet, so we do want to help people do that. There's a policy component of making that buying experience meaningful, but then we also have to get people to demand a different system politically, because it's going to take a political change to stop this practice. We're not going to stop it entirely in the marketplace.
I agree with everything Patty said. The confusion over labels is very, very important, and we also want consumers to be involved in the political process. And I would like to add that there's always the option to reduce your demand for these types of products. You know, participate in things like Meatless Monday and other types of campaigns, just to reduce, you know, the resource use and the pollution and health impacts that go into producing the food that you eat.
Okay, here's a question from online. It's a question about funding opportunities, and the person says, as a public health researcher, and given the level of federal regulation involved in this issue, do the speakers recommend a collaboration with the agencies to obtain the data to fill the information gap? Much of this research falls into the gap between the data the agency is collecting and the data researchers are interested in obtaining.
That's a very interesting idea. It depends how cooperative the agency will be. So a lot of the political factors for state agencies, if the governor's office is pressured by the IFAP industry in their state, then if an agency tries to cooperate with a group, whether it's a public health group or a concerned citizens group, to collect information, that could be a very fruitful partnership. But if it's too successful, there will probably be efforts to squash that effort, just like the policy change example that I was talking about before. So I think that's a great idea, and if there's receptivity within an agency in their state or in their county, I think that would be a great idea of where to start. Citizens groups do a lot of their own environmental sampling, and I'm not sure what the receptivity is within agencies to use that data. They usually like to then go do tests themselves if they'll be testing for that and looking for violations. But there could also be partnerships there where if people are trained properly and specifically on how to do testing, then why couldn't they rely on people who are passionate about it and want to collect this information, and then it would help with the funding issue and the staffing issues.
The idea appeals to me, but I'm from DC, so I'm cynical at this point. And we have gone down this road a little bit before, so we have to just keep in mind kind of the caveats of how that could be done in a way that it doesn't become an impediment to doing anything else. So I didn't talk as much about air as I did about water, but over the last decade, there have been attempts to get a handle on what are the air emissions from CAFOs, what are we talking about? And so I'm not going to get the year right, but during the Bush administration, the EPA made an announcement that they were going to do a study. You know, we have this data problem. We don't know what the impacts are. People that live next to CAFOs could tell you what the impacts are, but we didn't have an official understanding of the air emissions. So on paper, who's against the study? How could we not want more data? But it was used, I'll spare you the gory details, but it was used as an excuse to not regulate, and we're still not regulating because if you signed up for the study, you were guaranteed to not have an enforcement action. That's how they got people in. So the politics matter, the strings that are attached matters, and we don't want a study to become an excuse for an interminable delay. So as an abstract idea, absolutely, right? We want to cooperate, but we don't see a lot of cooperation at this point in this issue, and we don't want it to be an excuse for not regulating. And so those are my caveats to that concept. Yeah,
complex issue. Here's another question from online. Is there information showing that the great increase in production is due to a market demand locally? Is the production driven by the local consumer, or is the U.S. market just trying to produce and distribute these foods internationally? And the question is sort of, where is all the food produced going to?
I don't have any statistics in my head about how much meat we're consuming, but we are exporting meat, and so the best kind of recent anecdotal example is, I showed the map, and the middle of the country is hog production central. Iowa is producing enormous amounts of pork. That's not all being consumed in Iowa. And in fact, a Chinese company just purchased Smithfield Foods, a major pork producer here, saying that their intention was to send this pork to China. So we have a lot of other economic analysis about that, whether that stays the fact, but that was their primary short-term goal, was to raise the pork here and send it to China. And that leaves behind this model of production, that leaves behind the economic impacts on the town, the public health impacts, the manure. So we are exporting. We are also exporting this model, though, so other parts of the world are now raising animals this way. So there's an enormous amount of meat passing each other on the oceans in boats, but it's not being consumed domestically. If you look at that map of where we raise all these animals, it's not population centers, it's in rural places, and we're moving it somewhere else.
Okay, here's a question that it kind of links to that, the flip side. Are these issues dealt with in other countries in a better way? Are there any models?
Well,
certain things.
So Denmark has reduced or eliminated the routine use of antibiotics in hog production, and have showed that they can do that and continue to produce hogs, and it didn't kill the industry in the country. So that's one example. But China's probably doing it worse than we're doing it in general, with their, just rapid expansion of this and other industries in their country. The pollution might actually be worse than it is in the U.S. So it varies by country, but I know that in the EU they do a better job of regulating use of antibiotics in food production.
Okay. Any questions from the live audience? Could you just come up and use this microphone? The reason is that the people online can't hear the question unless you do that.
Mentioned Reagan time or Bush time that are affecting what is happening now, those specific policies, and if, for example, if Obama time changes anything, and is that really related to specific, for example, neoliberal policies, and if it is, what are those, and or if it is a kind of historical event that has happened after kind of overall industrialism or kind of thing. So I just wanted to know the exact policies that can be addressed now to solve this problem.
So I had those kind of three areas, right? Like the marketplace issues, can you make money doing it any other way? The feed issue, corn and soy, and then the environmental issues. So the biggest issue in that first category, the marketplace issues, is lack of enforcement. We have laws on the books that say, companies can't form a trust. We have antitrust laws. They can't operate this way. Some of them are 100 years old, and many of them have not been well enforced ever, and then some of them haven't been enforced since kind of the Reagan era. We've just seen a philosophical shift, and they just don't use these laws. So the mergers are allowed, the companies get bigger, things like that. On the commodity pieces, the corn and the soy, the feed base of these operations, we have seen laws change since. There's changes periodically but dramatic change in the 70s, 80s, and 90s. So one of the specific things that changed in basically there were many parts that combined to being that supply management I was talking about, so you don't have too much corn and too much soy and these low prices and everything's made of corn and soy. Those started to get chipped away every couple of years during the Reagan era. Every 5 years they would do a farm bill and something would get pulled out each time. The kind of final nail in the coffin where we no longer had any management of that came in 1996. with a specific farm bill that was passed that just said, do whatever you want, grow as much as you want, and we'll see what happens. And what happened was a lot of corn, a lot of soy, and a growth in this industry. And we're still haven't recovered from that, and we still need some of those policies like a grain reserve put back in farm bills. And then where you probably can pin the most policy change on a president, on an administration, is the EPA, FDA side, what the agencies do. And so, for manure, for the Clean Water Act, whether they have permits, we've never had a good system. It's not that we had it and lost it, it's that this has been a failure of EPA for a long time, and there's been little fits and starts, often through lawsuits, often through trying to force the agency to do something where you make half a step forward, but then it gets peeled back. The FDA, I would say this has been a problem for a long time at the FDA as well, but the specific things we would be looking for now is for the FDA to step up and change the way the antibiotics are used. They have the authority to do that, and they haven't really ever, and they're dragging their feet. And then EPA could redo, just do a new system for how they do the Clean Water Act and how they do the Clean Air Act, and whether you have to get permits. They've been forced, every step they've done, they've been forced to do, and they've never fully done it. And right now they're moving a little backwards. So there's progress that could be made at each of these agencies that interacts with it. And they don't need to change the laws there. They just need to use them. And that's a political decision that agencies have to make. I have other examples.
Okay, here's a question that takes us in a different direction. The question is if there's education going on in middle school and high school about animal food production. And I guess I would like to add to that whether there's any change in education in schools of agriculture or veterinarian schools.
I would say we have an exciting program at the Johns Hopkins Center for a Livable Future where some of my colleagues have developed a classroom-ready curriculum, a full curriculum that covers the whole food system. It's called Teaching the Food System. So if you go to our website, or if you Google Teaching the Food System, or if you go to our website, you can certainly find that. And it's made for high school students. You can use the whole thing together to cover the whole food system, or you can use different lessons as they fit into what different teachers are teaching. So there's been it was finalized, I think, in the past year or two, so there's been an effort to connect with different teachers so that they can use that as a resource. I'm not really aware of other efforts, but I think that as people are becoming more aware of it, then if teachers are interested in it, then they probably include it. In terms of agricultural schools, there's been a very significant decline in public funding for agricultural research and for agricultural schools, like land-grant schools. And what has happened is that industry has taken the place of the public funding. So the research is really not being driven by interest in what's best for the whole public, but it's now being driven in a lot of places by what the industry goals are. So there's not, if one of the big poultry producers is a big funder at your ag school, you're not going to be doing any research that has to do with the ecological and public health implications of the current production model. And that's been a very big concern and has had a big impact on the type of research that's coming out of land-grant schools and other agricultural schools.
Okay, any other questions from the live audience? No, I have a couple more online then. Here's one. Are any of these health concerns being dealt with in the courts besides antibiotics?
So there's two ways to look at that, and we don't get much information about the one way. So sometimes neighbors and the immediate community around, a CAFO may end up taking legal action when they feel like everything else has failed. You heard, they call, nothing happens, there's no enforcement. So sometimes those are about specific health complaints. Sometimes it's about, I can't go outside, there's flies, I have no use or enjoyment of my property. Those are called nuisance. It's really a demeaning word for what happens to these folks, and often what happens is they get settled and we don't know what happens, whether they acknowledge people had a problem or not. So we don't have a lot of access to see the resolution disclosure there because there's confidentiality agreements and things like that. There are, in the different sphere, of the law, there are lots of advocacy efforts to try to get these agencies to do something different. So there have been legal efforts to try to deal with the use of arsenical-based drugs, which were used widely in the poultry industry, either to mostly to get the FDA to rein in that practice, different steps at different procedures at different times to move that process. Similarly on antibiotics. Those are the two that come to mind. And then on the environmental piece, there's a long history of lawsuits trying to get the EPA to deal, especially with the Clean Water Act. And often that's how policy change from the agencies sometimes comes, is as a result of the lawsuit. The industry also does the same thing. So there's, there'll be advocacy groups suing the EPA saying, do this permitting. And right now we're involved, Food and Water Watch is involved in a lawsuit to get EPA to finish that rule about the data collection, that 308 rule. We want them to finish it. We filed it with a bunch of other groups. And at the same time, the American Farm Bureau has filed a lawsuit against EPA trying to make them promise they will never, ever release information again that has locations of CAFOs because some of us got some of that through FOIA. So they're trying to change how the EPA uses FOIA because they don't. So it happens often in both sides. Sadly, sometimes because we're not getting leadership from Congress or from other folks, kind of turn to trying to force the agencies to do something else through the courts.
Okay.
I would just like to add that when people sue the owner of one of these operations, it's very difficult to reach the integrators, corporate, the folks that have corporate control over how this production is done are not really reached by those kinds of lawsuits. And in addition, when you file a lawsuit like that, and it's called a nuisance suit, which isn't the best term for it, but in many states there's what's referred to as a right to farm law. And when there is a state level right to farm law, it says that you can't successfully sue a farmer if what they're doing is within the normal range of agricultural activities. Now, of course, the definition of normal agricultural activities was, formed when these types of operations were not even started. So there's that's a big gap in terms of legal protection for people who live near these operations, where having thousands upon thousands of animals at one location is viewed as a normal agricultural activity when in reality it has significant impacts for the environment and the people's health who live in the community.
Okay, we're out of time now, and I want to thank both of our speakers for what's really been a very interesting discussion. I think that really shows us the complexity of these issues, and especially the many parties that are involved, the different kinds of agencies, the different kinds of regulations or lack thereof. So I want to thank you both very much for spending your time with us and providing this excellent presentation. And for people online and in the audience, I hope that you'll join us on January 15th, 2014, to learn more about ways to age in place. Okay, thank you.
Wasn't sure what it was.